want sweat.
They don't want to sweat out.
They don't want sweat at all. Mr. Denny, yes, sir. Again, once again, a pleasure having you here. You have championed the cause for medical care in Cuba and Venezuela. Tell us a bit about that.
Well, let me start by saying that since 1998, I have organized for over 200 Barbadian students to study in Cuba. Beautiful. In the area of medicine, and a lot of them became specialized doctors, and are now working all over the world because they were denied the opportunity to practice in Barbados. In fact, we have about 90 medical doctors in Jamaica that would have studied in Cuba, working in remote areas and countryside in Jamaica, and are doing a very good job and are helping the Jamaican community. The whole idea was to send our students to Cuba to study medicine and nursing so that they can come back and give back to the Barbadian community. That did not happen. There's only about 8 or 9 doctors out of that 200 that are presently working in Barbados after doing the Caribbean Medical Council examination. And most of the doctors who went through the process in Jamaica and other countries to do that examination decided that it was better for them to remain there and work there because of the conditions and what they find and the way they were treated. And they decided to stay in Jamaica. You have to respect that. But some would have gone to first world countries and other Caribbean countries to work. The truth is that we need to seriously look at health care for poor working class people in Barbados.
Mm-hmm.
A lot of poor people cannot pay for health care because of the cost. And in the past, both governments, the government of Cuba and Barbados, set up a program for eye care for many Barbadian people to travel to Cuba for eye care. I honestly don't know why that program came to an end. But a number of Barbadian people benefited from that eye care program. And that program between Barbados and Cuba, they organized the international travel so that you can travel to Cuba for free, the accommodation and meals for 2 weeks, the operation costs, and everything was organized by the governments of Barbados and Cuba. And then it was also assisted by the government of Venezuela, who paid for the medical care that Cuba was offering. I am an example of that care, not of that program, but I went to Cuba at a time when I could not see. When I told I could not see, I cannot even drive my motor car. And the Cubans put me through a program, a diabetic program, where they look at my history from a child and then advise me how to take care of myself, how to doctor myself. So it was not only treatment, but they taught me how to take care of myself. And they put me on, because the medication I was using here in Barbados had me very, very sick. And they put me on medication. And then they told me how to come off of that medication. And that was it from as far back as 2017. I don't use medication anymore. I do not use any medication. And I had operation on both of my eyes. I don't wear glasses. And I can read anything. That's what the Cubans did for me. And that's what they were doing for other Barbadians who were going to Cuba. So I think that, and I'm very happy to be here. I think the Democratic Party need to investigate this. I think that their party need to look at developing a project with Cuba for healthcare, because there are many benefits that the people of Barbados can gain from a public healthcare program. And we saw the Cubans coming to Barbados during the COVID period. And we saw the work that they did when they were here. Yes, so we send them back. They don't understand. I mean, it shocked me. It really shocked me. Because there are poor people in Barbados. If you speak to anyone now that would have gone to the hospital and asked for operation in June, they will tell you that they're ready to get an operation in 2025, August, September. Things are unfair to poor people, especially when you can develop an opportunity with the government of Cuba for training. Because when we train medical doctors, we should be organizing ourselves to bring them back here so they can work in the public health section so that the people can benefit from it. And we should be using the opportunities that Cuba can offer us, and they have already offered us in the area of dealing with diabetics. In terms of even condition there, they have a system that they can save people's legs. We should be dealing with these things. With Cuba may be going through a problem because they may not have all of the medication because of the embargo, but they have trained the medical doctors, and they're helping poor people all over the world, not only in the Caribbean. They have over 400 medical workers in Haiti at the present moment, even though Haiti is going through a crisis situation. So that I am very happy to be here, to be given the opportunity to participate in this kind of discussion. But I think we have to take it to a higher level, and an honorable level, and an honest level with the poor, working class people in Barbados.
Mm-hmm.
Because there are many, many, many problems at the QEH. And most of these problems are also being created by our IMF program. Our IMF economic program are robbing the poor working class people of their resources, their financial resources, and then we can't deliver the services to the people so that we can help the very poor in Barbados. And when I come here, I can speak on behalf of the poor. That's my passion that we have always been part of. And I'm going to defend the poor and powerless people. I accept that you must have some form of private sector within the medical industry. But at the same time, I think community medicine is an important area for us. And I think we need to create the conditions for the very poor in Barbados.
Ramon, I think that Denny hit the nail on the head in terms of, because you've heard this sentiment in Barbados that a lot of Barbadians feel to think that healthcare in Barbados is now being privatized. And you get that when you hear the communication officer for the Queen Elizabeth Hospital telling persons not to come to QEH for emergency, to go to the other healthcare facilities when Sir Winston Scott may not be open, the other polyclinics may not be open, so you have to put up money to pay for the private healthcare facilities, which a lot of people don't have. And that's the reason why you're finding this problem now with a number of people going to accident and emergency for treatment, spending 3 days or more before they actually see a doctor or get the treatment, and then a lot of them are actually dying within accident and emergency. So as a country, how can we feel comfortable with this situation, especially after COVID? So that's why we wanted to have this wider conversation about the health and wellness of our people, and then to show up really the deficiency in our primary care facilities, the polyclinics, and also to show up the fact that, as Denny rightly said, this IMF austerity program is robbing a lot of our institutions of vital resources necessary for the said doctors and nurses to be able to administer the needs of the people. As he said, you can't go to the if you go to the QEH for a glaucoma or whatever the case might be, a cataract surgery, and telling you that you have to wait until next year to get treatment, it is ridiculous. Or if you have a back problem and you need a CAT scan, and telling you, or MRI for that matter, and giving you, and you are in pain and in agony, and telling you that you have to wait for until 6 months down the road in order to get that procedure done. By the time you get it, your conditions is probably worse. And that is why a lot of persons are not necessarily making it out of accident and emergency, because then you go home and you suffer with your pain, not getting the diagnostic tests that are necessary. And by the time the whatever it is erupts and become unbearable, you have to get the ambulance to take you to the hospital, and it may even be too late. This cannot be the Barbados that we want for 2025.
And I totally concur. Now, Mr. Denny, he mentioned human resources. He mentioned about, based on the analysis, based on the circumstances he mentioned there, there's a serious brain drain. We have